what I understand from people who have gone through this experience, this is often the most difficult moment because there's a lot of unknowns. You just don't know how it's gonna go. You don't know what it's gonna feel like, how uncomfortable it's gonna be, what it's gonna be like to operate the drains, and how your body's gonna react to the medications they're gonna put you on, and everything is just kind of ominous. So these are the things that I've been doing to prepare. Primary things that are particular to me is, first off, I want to have my tissues surrendered back to me because it's mine. I grew it. There have been a lot of strangeness around that request. I've gotten pushback. So I've had to use the magical words of "it's my religion," and then all the doors open up. They are going to send the tissues off to pathology to just make sure that there isn't any cancer that they haven't found in the screenings, which is great. I'm super happy for all of that. That's been one of the primary things that feels really important to me. And it's fine if it doesn't feel important to you. People have different relationships with that kind of thing, with their bodies, with spiritual practice, with ritual and ceremony marking the transitions of your life. And I'm just someone who interfaces with the world in that way. I had an acupuncture appointment yesterday, connecting the liver and the lung points, just preparing my body to be in a receptive instead of resistant place for surgery. Chinese medicine's amazing. It seems like it shouldn't work, but it's like magic. It's so brilliant. I don't know. I'm really lucky I have a friend of mine who is a Chinese medicine practitioner and had time in her schedule to see me. Food in the hospital is going to be a hard thing for me because I have a really sensitive system and a very restrictive diet. I have a friend who's going to be helping deliver food to me. I'm not sure yet if we're going to have a fridge in the room that we're going to be given. Some of them have it and some of them don't. So the things that I've been doing for my body pre-surgery, I've been working outside in the garden nonstop. Right now, I'm actually recording this on Beltane. It's the beginning of summer in the Celtic tradition. And so I've just been working my body. I was told by the PA at the plastic surgeon's office that anything that I do to get my body as healthy as possible pre-surgery is going to translate to how the recovery goes. I would definitely take a look at trying to eat an anti-inflammatory diet. I do think that these things make a huge difference with how recovery goes. I have no idea what's going to happen or how it's going to go. In my life, the way that I've naturally been preparing is through deep cleaning of my home and pulling everything out from all of the places where they collect and pulling it all out and sorting it out and taking things that need to be trashed, things that need to be given away. And it's just been a whole month of that for me, trying to get into all of the nooks and crannies of my life. And it kind of makes sense that I'd be doing that in Jungian psychology. The home is the manifestation of the psyche. And so doing clearing out just kind of makes sense. Doing everything that I can to spiritually, psychologically prepare myself for that reality, I think is going to be really helpful in how the recovery goes. I was told by my plastic surgeon's office that people in my position have the hardest time with recovery because it's an elective, I would actually choose this if given the chance, but it's an elective surgery in the sense that I'm not up against a cancer diagnosis, that women who have a cancer diagnosis come into it with a slightly different orientation to psychologically handling what's happening. Even though elective, I wouldn't actually choose this for myself, I would much prefer to stay intact, thank you, but making the best of it as it comes. So emotionally, women in my position who are getting a prophylactic surgery from a place of health have the most difficult time with recovery. I thought that they meant physically, but they actually mean emotionally, and that makes a lot of sense. So this is something that I'm trying to do what I can to prepare myself for. Something else that I've been doing is practicing sleeping sitting up. So last night was the third night that I've been sleeping up on my wedge. Each night is getting a little bit easier and easier. So that way I'm not making that direct change while I'm also experiencing the after effects of surgery that I've already done a little bit to prepare myself for what sleeping is going to be like. I feel like that's been really helpful, actually. It's not easy to sleep on one's back, at least for me. I'm like a fetal sleeper or a stomach sleeper, so that much has been hard. Tomorrow is our land Beltane celebration. We're gonna do the maypole, and I'm gonna have some, personal time to interface with this transition in a more intentional and ceremonial way, saying goodbye to this current form of me and moving and clearing the way for this new emergence. I'm thinking of it as a true 8 weeks of recovery that I won't even be ready to interface with regular life until the 1 month mark. And then we can assess and see how that 2 month mark is gonna go. But it's helpful for me to think of it that way, as a whole cycle, a whole moon. What's ironic is the first day of my cycle is the day that I'll be coming up out of surgery. So it will be an actual literal cycle for me. The timing is so great. Who doesn't want to be in the insanity of the luteal phase leading up to surgery? So fun. But my garden is weeded. It's going to be in something of a holding pattern until I'm ready to get back out there. Living off-grid and homesteading as I do, this is a terrible time of year to be taking time off, but I've done what I can to try and prepare our space for that, and I know that I'll have a lot of support and a lot of help. My community has organized us a GoFundMe. They've organized us a meal train. There's also talk of them having self-organized a hair braiding train and childcare train. So between all of those different things, I feel really well supported and moving into the unknown as prepared as I can possibly be. So 3 days out, 3 more sleeps before my surgery at 5 o'clock in the morning. My plan for the night before surgery is to not really sleep. I probably won't be able to sleep anyway, but to just be on my yoga mat and stretching my body and saying goodbye to my body and doing all the things that they want me to be doing. So, yeah. Here we go.